Welcome back. January is Cervical Cancer Awareness Month, and the WHO African region joins other WHO regions in marking this month to promote the three key messages of this year's campaign: be informed, get screened, and get vaccinated. Joining us with more on this is medical doctor at Sterling Medical Center, Dr. Cornelia Ndifon. Dr. Ndifon, good evening and welcome.
Good evening.
Thank you so much for being here.
Happy New Year to you, Nina.
Thank you so much, and to you
Good
too.
Good evening to all the listeners.
Thank you. Thank you so much.
Yeah.
Doctor, let's get right into it so that time doesn't get the better of us. Let's talk about the common risk factors for cervical cancers. Let's start there.
Yeah, there are quite a lot of risk factors. And I want to start with just being female, the female sex. Is a risk factor. But having infection with HPV, human papilloma virus, because as you would see, it is the actual cause of cervical cancer. Then having STIs like HIV infection and even other STIs like herpes simplex virus. You know, smoking has also been associated as a risk factor for cervical cancer. Yeah.
And
yeah.
HPV itself is also sexually transmitted. Is
yes.
that correct? Right.
Yes. Yes.
Also, I want to talk, about the typical diagnosis process that happens to detect cervical cancer. Talk to us about that.
Okay. So I would like to say that if you ask me candidly, I wouldn't want anybody to come with symptoms of cervical cancer because it might be just too late. But for the purpose of preventing, we are asking people who feel normal, women who feel healthy, to just walk to the nearest health facility, be it private or public, and ask to be screened. Now, we have three methods of screening. The pap smear method, which is like the oldest, okay? Then you have the VIA, visual inspection of the cervix after application of acetic acid. And the third method is HPV DNA testing. So these are all screening methods, okay? So when you do the pap smear, which we have been doing for women that are 50 years and older, okay, it is best for them, although it's been done for even 20-year-old.
Yeah.
But now we know better that it is preferred in women that are 49 years and older. We do that pap smear. If the result is negative, we are fine to some extent. I will explain some things later. If it is positive, we proceed to do what they call colposcopy and biopsy, where you now actually get a tissue to do histology to nail the diagnosis. Then if we do not do pap smear, we do VIA, which I just said, visual inspection of the cervix after application of acetic acid. There with VIA, you get immediate result because you are going to see changes that are telling us that these cells are abnormal. We describe them as aceto-white. You can just see that there's a patch which is different from the normal color of that cervix. When you do VIA and you get abnormal results, you can treat it in three ways. There's what we call thermal ablation, destroying those cells with heat. There is cryotherapy, destroying them with cold. And then there is LETS, which is, sorry for the grammar, but there's no way else. It's excision, but it's called large loop excision of the transformation zone. That excision, again, gives you a tissue, which you can study under histology. Okay? The histology, again, is how we nail the diagnosis of cancer. But in screening normal women, we're trying to look for pre-cancer, because we don't want somebody to come with cancer. Yeah, so those are the steps of trying to look for pre-cancer. But in the course of that, you may pick early cancer. Or you actually see full-blown cancer with your naked eye. You cannot even identify the vagina, if you will allow me to use that, or the cervix, because it is so disfigured that we call it distorted. But that is still suspicious. To nail the diagnosis, you take a biopsy, you do histology.
You mentioned that, of course, you want women with no symptoms, healthy women, to come and, you know, be screened.
Yeah.
But in the event that you are concerned that you might be, either due to lifestyle, due to the fact that you smoke, whatever it may be, hereditary, you might be a candidate for cervical cancer. What are the symptoms that one should be looking out for?
Very good question. There are a lot of them, from simple what we call intermenstrual bleeding. So a woman should bleed once in a cycle of, say, 28 days. Let me use that average. But if you are bleeding too frequently, you should just not sit at home. Go and see a doctor. And maybe that will lead us now to, there's early cancer. Another one is postcoital bleeding. After sex, somebody should not bleed. But if that happens, it should concern you. Thirdly, post-menopausal bleeding. You know, menopause means that I've done my job on this earth of menstruating and having children or not. And I'm 50, 51, menopausal. After that, I shouldn't bleed. So anything post-menopausal bleeding, it should worry us. Now, there is offensive or foul-smelling vaginal discharge, which the woman will feel like, my pant is always wet. And it might even lead to some kind of body odor, because if somebody comes close to you, they will feel some awful smell. But you yourself, you are feeling that this smell is not okay. That is due to foul-smelling vaginal discharge. You mustn't wait. Go and see a doctor or a nurse. Then we have, things like leg swelling, which to me, it's almost like a late sign. Yeah. And then lower abdominal pain. Okay? So you just keep having this pain. Don't just sit at home and say, maybe take painkillers. In fact, we used to say, once you take painkillers and the pain is not going, after 3 days, go see your doctor.
Right, right.
Yeah. So those sort of things should make people to just go and say, check me. Don't live with these symptoms, because the first time you notice them, like I'm saying, it might just be early stage cancer that can be dealt with. But if you keep taking medications on your own, or unfortunately going to a facility where people are not picking up to say, then it might become just too late.
Yeah. Well, Dr. Difon, thank you so much for being here with us, and thank you for your time.
Thank you. Thank you.
That was Dr. Cornelia Difon speaking to us about January being Cervical Cancer Awareness Month. Of course, she's mentioned the symptoms, but even if you think you're perfectly fine and healthy, it's important to have these checkups. And if you're eligible, go and have a pap smear done. Otherwise, just have a general checkup with your doctor. That also wraps up today's edition